Hey, Amy. So today we're going to be talking about diving deep into the world of healthcare, primarily TRICARE and the other various things that military members deal with when they're looking at healthcare. We're actually going to split it up kind of in two sections. One, kind of while you're serving, what are the options? And then, what changes in retirement? And then again, in ultimate retirement, when you qualify for Medicare.
This is great. I'm looking forward to this podcast and the next one. Whether you're active duty or reserves, making sure that you understand the options that you have for your family is important to your health and financial well-being. So let's get started.
Welcome to Operation Retirement Readiness, where Amy and Mike, two certified financial planners, talk about how military members can prepare for transition and how veterans can prepare for ultimate retirement. This podcast represents the views of the hosts and any guest. It is for informational purposes only and should not be considered tax, financial, or legal advice. All information is regarded to be from reliable sources. The hosts are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast. This podcast is not intended to replace professional advice.
All right, Amy. So today we're talking about, again, all things healthcare for primarily this one active duty or reserve military while they're still serving. What are those options that you have, and how does all that work? Like I was saying before the podcast, before we started, this thankfully my wife handled most of this because it really, when you're in, it's like, hey, we go to the military treatment facility, MTF, and you get seen and try to avoid going as much as possible typically. So I don't have tons of experience in this, but after working with clients and going through the retirement transition and seeing what those options are, you know got a little more educated on this. So again, I'm looking forward to helping folks as they approach this and figuring out what are the right decisions regarding healthcare for them, while they're serving, and then finally after also.
Yeah. So, big picture, let's just run through the options, right? So while you're on active duty, you're covered by, TRICARE Prime. You're primarily seen by the MTF. But your family is also covered by TRICARE Prime. We'll talk about kind of some nuances in between there. And then if your family would like, an option is TRICARE Select. So the active duty service member is always TRICARE Prime, probably getting seen in the MTF. But even if not covered by TRICARE Prime, the family members can choose to be covered by TRICARE Select. We'll talk about that in a minute. If you're a reservist and you're drilling, you have the option to be enrolled in TRICARE Reserve Select as long as you're not covered by the Federal Employee Health Benefit Plan. And then we're going to talk about one more plan that's just kind of out there, and that's the cover dependents. So your younger dependents that have aged out of being covered under regular TRICARE, but they are not quite ready to be out on their own policy. So that's TRICARE Young Adult. So that's the big overview of all the options that we're going to cover today. Mike, you want to give us a big overview on TRICARE Prime or the HMO option?
Yeah. So HMO is thrown around, health maintenance organization. It's very common on the outside. But basically what it means is you have a primary care manager, the main doctor that you see, and they are responsible to coordinate your care. As you mentioned, all active duty members are covered by TRICARE Prime, typically seen in the MTF, and unless you're stationed somewhere where there isn't an MTF, then you might see a basically civilian provider that still acts as your PCM or primary care manager. And families may also be seen in the MTF. Sometimes their PCM is in a military treatment facility if the base is large enough and they have capacity. This is, I think becoming less common, as we go, just because of the demands and trying to kind of right size the medical teams that, the military has. So, But those are, usually the options for, TRICARE Prime. And again, you have your PCM. If you need additional services, say you need to go to an orthopedist or a dermatologist, if that's not available in the MTF, again, that PCM will make that referral out to, somebody that can treat you for what you need.
Yeah. And the trade-off, because I think as most of us have experienced, it's kind of a pain, right? You have to see your PCM for everything. You can't go to the specialist you want to see. But essentially what you're giving up in, I'll say, convenience, you're gaining in affordability. So service members, and while on active duty, there's essentially no monthly premiums for TRICARE Prime. So even if you're, we haven't used the term TRICARE Prime remote, that's when you're stationed away from a military treatment facility. Your care's still managed by TRICARE, but you're out of the military network and into sort of the broader TRICARE network. So, still, while you're on active duty, you're not paying for TRICARE Prime, and there's not copays and deductibles, things like that, under TRICARE Prime or TRICARE Prime Remote. So, kind of there's that trade-off, but, and families do have an option. So we'll talk about that in a minute. But for now, let's go back to, what you need to do to get enrolled while you're on active duty to get enrolled in TRICARE Prime. Let's just walk through that, Mike, because that might be confusing for people.
Sure. Enrollment is basically automatic and mandatory for military members, as we've stated. And then, family members will actually default to TRICARE Prime, for serving members. But they can switch, during an open season, or if they have a qualifying life event, like, maybe a baby's born, or you get married. Those are qualifying events that are kind of outside. And then, we'll talk more about this in our next episode. But as you retire, you have 30 days to, decide between TRICARE Prime and TRICARE Select after, as you approach retirement.
Yeah. So, basically, it's the default. TRICARE Prime's the default. Now, one thing that I'll also add, so we talked about TRICARE Prime Remote. So again, TRICARE's still the manager. There are some areas across the country. So I'm here in the Northeast, so actually Mid-Atlantic. So my plan here, an option for me here, so this is still a TRICARE Prime plan, but it's administered by Johns Hopkins. And there's a few plans like this across the country administered by, sort of private contractors, if you will. Works the exact same way, meaning you still need referrals from your PCM, but you are in a different healthcare system. So you have that option as well. It works the same way. So if you're a service member, again, you're going to be seen by the MTF or TRICARE Prime Remote. But during open season, your family members could select TRICARE Prime or U.S. Family Health Plan. So for different areas of the country, U.S. Family Health Plan - whatever the contractor is. So here in the Mid-Atlantic, U.S. Family Health Plan, Johns Hopkins. So you also have those options out in the out west. They have the PAC Med centers. I can't remember what all of them are, but there are about 5 or 6 across the country. So that's basically the HMO sort of default active duty option. Mike, let's talk about TRICARE Select and the PPO option.
Sure. TRICARE Select, like you said, more flexibility. Basically, you can go see any doctor that you want to. If you think you need to go see an orthopedist, instead of having to go see a primary care doctor first, you can go out and just go directly and see that orthopedist that you want to. So again, as you said, you're trading off flexibility but now you're going to pay. There's additional costs with that PPO, TRICARE Select. So we'll get into that when we talk costs, but that's really the biggest piece of it.
Yeah. Yeah. And so PPO is preferred provider organization. So there is still a network. And there is a difference. So you can pick anybody that you want, but if you pick a provider that's out of network, it's going to cost more. If you pick a provider that's in network, it's going to cost less. But because you have a choice, it costs. So there are premiums and there are out of pocket costs associated with TRICARE Select. For some families, they're more than happy to pay those out of pocket costs because it offers them the flexibility to access more immediately and more easily access the kind of specialists that their families need. We'll get into costs in a little bit, but definitely need to understand that what you're giving up in terms of saving money, you gain in flexibility, but also likewise, you're gaining flexibility. So therefore, you're going to pay a little more for it. Let's move on, Mike, to the reserve side of things. So this plan is for drilling reservists. So TRICARE Reserve Select. Can you tell us about that?
All right. So if you're a reservist, either ready reserve, not the inactive ready reserve, but you're not on active orders for more than 30 days and are not covered by, like you said, the federal employee health benefit. You can opt into TRICARE Reserve Select, and it's similar, but there are a few differences. So you want to hit kind of what the general differences, Amy?
Sure. Yeah. So if your employer doesn't offer health insurance, or they don't cost share, so it's very expensive, TRICARE Reserve Select is a pretty competitively priced health insurance option for reserve families. So reserve families can find a lot of savings. So if you're a reservist listening to this podcast and you didn't realize that you have a TRICARE option, definitely recommend that you check it out because you could be saving money. Doesn't mean you will. It's an option, not a requirement. So if your employer plan is amazing and inexpensive, that's great. Use that one. But if you're either in between jobs, or your employer doesn't share cost, it means there's a good chance your health insurance is expensive, and TRICARE Reserve Select might be a better option. Now, it is a little bit unique. The reserve situation is a little bit unique in that when you retire from the reserves, your option for TRICARE Reserve Select goes away. Mike, do you want to talk to us about gray zone retirees and how
Sure.
their care works?
Yeah, like you said, that TRICARE Reserve Select goes away at retirement, and unfortunately, you're not eligible for full TRICARE until age 60. So if you've got a gap, you retire at 44. What are you going to do for those 16 years? Well, depending if you're working, have other insurance, that's definitely an option. But if not, maybe you're self-employed or something else. There is a TRICARE Reserve Retiree, which can bridge the gap, although it's definitely not as affordable as the, TRICARE Reserve Select that you have access to while you're or while you're serving. So again, you're going to want to look at the costs on that and figure out if that's the best, or if it's an employer plan, or possibly even the healthcare, the ACA, using that for healthcare marketplace to find a plan. So definitely do your homework if you're in that situation, that gray area between reserve retirement and actually turning 60 and becoming eligible for TRICARE.
Yeah. And I mean, this is a huge planning factor too. So it's not something that you want to just let happen. You definitely want to be looking out and planning your retirement. We've talked about that in other episodes, but this is a critical element to plan for, so that you understand when your employer coverage could pick up, or when your health exchange coverage might pick up, or if you really have no other option, then TRICARE Reserve Retiree. One other sort of plan, it doesn't fit well between the two episodes, so we're just going to cover it here. So essentially, again, TRICARE Young Adult, this is for your younger dependents who have aged out of your TRICARE plan being able to be covered by your TRICARE plan, but they are either don't have access to health insurance another place, or it's much more expensive, although TRICARE Young Adult is a little bit expensive. So Mike, do you want to talk us through a little bit more about TRICARE Young Adult?
Yeah, so basically it extends coverage, but again, it's not free. So it's really available up till 26 for your dependents. It typically applies after you've they've either aged out of high school if they don't go to college, or if they've gone to college, they can still be covered under, directly under TRICARE. But then after they get out, and a lot of this, this option came because of some of the healthcare changes on the civilian side that extended and required plans to cover dependents until the age of 26, or give you that option to do that. So one complaint that you hear a lot about TRICARE Young Adult is the cost, because it is relatively expensive, especially when you consider how it's happening on the civilian side. So I know there's been pushes like, hey, we need to get this equivalency between what civilian insurance plans have to do for the young adult dependents and what TRICARE does, but so far it has not wound its way through Congress to get approved to have the same coverage. So
Yeah. Well, let's shift gears a little bit and let's start talking about the costs and kind of how the costs work. So starting, kind of from big picture, TRICARE costs are the first thing you need to know is you're going to be in a group, so either Group A or Group B, and your costs are associated with what group you fall into. If you are Group A, then your initial enlistment occurred before January 1st of 2018. If after that, then you're in Group B. So there are different costs based on when you came into the military. After the grouping consideration, the next consideration is an annual enrollment fee. You might think of this like a premium. TRICARE calls it annual enrollment fees. These are sometimes often billed monthly. It's based on whether you're an individual or an individual plus one, meaning you're a family, or individual plus 20, you're still a family. And then after the annual enrollment fee, then there are the costs that are for out-of-pocket things. So we don't want to get too far into the weeds with what things cost, but Mike, just for context, maybe you can call out some of the costs associated with TRICARE Prime, so the annual enrollment fee, and then some of the out-of-pocket costs, and whether there's an out-of-pocket cap.
sure. So while you're serving, there is no kind of enrollment fee for TRICARE Prime for either of the groups. There is an annual catastrophic deductible for each part of the plan, or for each group. For TRICARE Prime A groups, that's up to $1,000 per family, and for TRICARE Prime Group B, that's up to $1,288 per family. So again, the catastrophic cap means if you do have other costs that aren't covered for some reason under TRICARE Prime, once it hits $1,000, as long as you're still going through the PCM and doing those things, all of the rest of the costs will go. TRICARE will pick those up.
So for TRICARE Select, let's talk about the enrollment fees. So no enrollment fees for Prime, but if you choose to have that flexibility, then there is an annual enrollment fee. So if you're, just for context, in Group A, it's about $365 a year, which is very inexpensive for health insurance. And it's about, between $1,100 and $1,200 per family per year for Group B family. So more expensive, but still a very good deal for health insurance compared to your peers, and compared to what you might be able to get to, you might be able to find elsewhere. You do have to have do have to meet your annual deductible. Again, this is going to depend on your group. It also depends on your pay grade. So a deductible means that you're going to cover all of the cost of the visit to the specialist up to a certain amount before TRICARE will start to pay anything. So that's what a deductible is. They're relatively low still for both Group A and Group B, but you do need to know that you're going to pay that annual enrollment fee, and then you're going to pay at least the deductible. From there, then there's a variety of out-of-pocket costs that might be associated. So it could be a copay for a primary care visit anywhere from say $27, maybe $30. If you're going to a specialist, it's going to be more expensive, maybe upwards of, 38 or $50 or something. So all of this, you can find all of the details when it's time for you to do an analysis. You can find all of the details on the TRICARE website under costs. For now, though, Mike, let's keep talking about cost and give people context for Reserve Select.
All right, so we'll talk about TRICARE Reserve Select. Again, there is a premium for this. For if you're just covering the member, it's $53.80 per month. If it's a member and a family, it'd be almost $274.48 per month, so almost $275 per month. There are deductibles that go with that, and that is, again, sort of depends on rank, but above E5 and above is $193 per individual or $386 per family. And then the annual catastrophic cap for TRICARE Reserve Select is $1,288, basically the Group B costs. So, definitely an option, but as we talked about, you'll want to make sure you're shopping around before you decide that that's right for you if you're still serving in the reserves.
Okay, so for TRICARE Young Adult, it's a very unique program, but just to give you context of cost. So cost for an individual for TRICARE Prime, it is a monthly premium. So we were talking about annual enrollment fees before. This is a monthly premium. It's $727. Now that's for the TRICARE Prime Group B version of this. There is a select option under TRICARE Adult as well. It's actually a little bit cheaper though. However, you could probably expect out-of-pocket costs to be much more expensive. So that kind of brings us to, how do you make this healthcare decision? It's a default decision when you're in active duty. You're going to be in TRICARE Prime. You don't have to think about it if you don't want to. But if you're a reservist, if you're a young adult who's aged out of TRICARE, you have some considerations. So, Mike, do you want to start walking us through some of the considerations for how to pick a plan?
Sure. So, one of the big things is, where are you living? If you're on base and have access to the military facilities, that makes it, relatively easy. We talked a little bit about, if you're off base, while you're still active duty. But again, for your family, it's, what's convenient. How do you figure out what, doctors in the local area are there to serve, and can you find a PCM, that isn't 45 minutes away type thing that's covered under TRICARE Prime. What else, Amy?
Yeah, so then it comes down to, so besides, where are you, who's available, what are the network, what doctors are in the networks. Now a big driver might be your actual health needs. So, if you have a special needs family member, they have certain needs. If you have a spouse working through cancer. They have certain needs. So it really kind of depends on your health conditions. Now, if it's, if it's something like cancer or a special needs child, like probably the cost goes out the window a little bit. You probably categorize that as a lower priority. But if it's normal, what I'll call kind of normal stuff where it's maintenance and things like that, where maybe a spouse needs a lot of physical therapy or something, then it's a good idea to just, make a list of all the reasons that your family tends to see the doctor, as well as all the prescriptions, because we didn't talk about prescription costs associated with these plans, but they all have their own prescription costs associated with them. And once you make a list of all of that, then figure out, what does it probably cost for each plan, given what you think your family is going to experience in terms of medical needs. Not always predictable, right? You can't predict when you're going to end up at an urgent care clinic or an emergency room or something like that. But you probably have a good idea. If you have little kids, there's a good chance you're going to end up in an urgent care clinic because they only get sick on the weekends when things are closed, right? So I literally like to kind of lay all that out when I'm helping clients make their decisions. I really like for them to kind of give me some ideas without getting too personal about what's going on, but give me some ideas on what kinds of doctors they see, what kind of prescriptions, and then figuring out which plan ends up being least out of pocket considering premiums and copays.
Yeah, and then finally you hit on some, but the financial piece. Once you lay that all out, come up with a number and see if it works. Again, all the plans have relatively low catastrophic caps, so looking at that, it could make sense, like you said, for those if you need that specialized care, and you can get to that, that catastrophic cap isn't going to be too onerous to get to, then it could make sense to just go with the TRICARE Select, in that situation, just if there are better options to be able to see the doctors you want to see that are in that network, and you can get in easier. So
Yeah. Well, I think that's a good place to wrap up on TRICARE while you're serving. So hopefully listeners learn some things about TRICARE, know more information. Next time we're going to be covering TRICARE when you transition in retirement, which I think probably people might have even more questions. So we'll head into that next time.
sounds great. Look forward to it.
Take care, Mike.
Bye.
To get transcripts, show notes, or more information, go to operationretirementreadiness.com. Have a question or topic for the podcast? Send it to info@operationretirementreadiness.com. Find out more about Amy and Mike at their websites. Mike is the founder of Next Mission Financial Planning, LLC. He retired from the U.S. Air Force and has worked in the financial services sector since 2021. He is a certified financial planner, chartered financial consultant, and a certified college financial consultant. You can find out more about Mike at nextmissionfinancialplanning.com. Amy is the founder of Instar Financial Planning, LLC. She is retired from the U.S. Army and has worked in the financial services sector since 2019. She's a certified financial planner, a chartered federal employee benefits counselor, and a chartered retirement planning counselor. You can find out more about Amy at instarfp.com.